Welcome back to your home of humanitarian journalism, Salam Media. The time is 11 minutes past 9, and we're going to be switching gears now to a topic that I think is very, very important for all South Africans. As the country stares down, I think what at this point we can all agree is a healthcare crisis. The government has announced the hiring of 1,200 doctors for public hospitals, a move welcomed by many, but with just 200 nurses approved for recruitment. The silence on nursing shortages has ignited outrage, especially from the country's largest nursing unions. And one thing that really struck me is with the patient-to-doctor ratio in some provinces being as high as one doctor for every 4,000 patients, and nurse vacancies also soaring, the very backbone of healthcare delivery seems to be under siege. Meanwhile, Health Minister Aaron Motsoaledi says medical aid schemes are unsustainable, and the solution lies in a tax-funded National Health Insurance, the NHI. But critics ask, will the NHI really work when there are no nurses to implement it, and so many of our public health institutions being in disarray? Joining us now is, I think, one of the foremost leading voices in South African healthcare, Dr. Kgosi Letlape. He's the founder of the African Medical Association and former chair of the South African Medical Association. Is also a health activist. Doc, thank you so much for joining us. Really, really appreciate your time. And to kickstart the conversation, just your quick reaction to Health Minister announcement of those appointments, 1,200 doctors and just only 200 nurses for recruitment.
I guess it might also be appropriate to start by completing my credentials that I'm now a member of parliament.
Member of parliament also, sorry.
And a member
yes.
of Action SA.
Action SA MP.
And a member of the Portfolio Committee of Health in Parliament.
Yes. Thank you so much for that.
I think the major problem is basically that we don't have transparency. That's the first point. Things are quite opaque. Nobody knows what is the human resources health plan from the national department. Nobody knows what our needs are of the different healthcare professional categories and health worker categories. And as such, you don't know whether this is adequate or this is just a reaction because doctors have been vocal about being unemployed. We've had nurses being unemployed for years, and maybe there's lack of vocality there. But what is concerning would be, the doctor-nurse ratio. You need 3 to 4 nurses per doctor. Now, when you have a crisis in both, and you're employing 1,200 doctors and 200 odd nurses, the ratio doesn't make sense. Remember that healthcare is provided by a team, and you need to employ a proper healthcare team to provide proper healthcare services. The other major concern is the fact that this is not like we've employed this number of healthcare professionals. Funding has been made available to employ these professionals, but there's no guarantee that that funding will be used for that purpose. Despite agreements from the meeting of the National Health Council, you can't have agreements that are not supported in law because then they are not enforceable. So the provinces can still do what they want with the money that will be given to them. There's something structurally wrong with our healthcare system. And unless the minister earnestly begins to address those structural issues. For health to work, health must be a national competence. That's where you start. So when the minister says, I've got this money for this purpose, under the current circumstances, they must give it as a conditional grant to the provinces, that it can only be used for that purpose. And that is not the case at this point in time.
I think you make some very, very important points, Doc. And I want to touch on that, just the lived reality on the ground and what it looks like, for nurses and patients. We have the long-standing issue of the long queues, overworked staff in our public health institutions. As a doctor, as someone that's so close to the reality on the ground that is faced by particularly the most vulnerable in our society, could you paint that reality for us and what it looks like in the public health sector, and if the solution to mitigating it that has been presented by the health minister Aaron Motsoaledi is enough?
It is clearly not enough. Let's begin about the reality that the people face. You go to most of our clinics, they are overcrowded. There's too many patients. There's not sufficient staff. The facilities are not adequate. The minister has spoken about the incident at Helen Joseph, and that a lot of the findings were around the hospitality services. Now, people must be aware that health outcomes depend not only on the clinical care that you provide. I'm a surgeon, and what I do is important. It starts with me. I must be technically correct. I must be competent. But the success of the procedure also depends on the post-op care. You can do a good operation. If the post-op care is not adequate, the patient is not going to make it. We mustn't trivialize the issues about cleanliness of hospitals, infrastructure, and toilets that are not working. Part of the things that contribute to morbidity and mortality is hospital infections. Those are not related to the number of doctors you have. Those are related to the healthcare team. Those are related to the cleanliness of the facility. So we should not trivialize the other aspects of an important facility and call them hospitality services. That's the totality of care that our patients deserve. And all aspects are critically important. So this, notion of, the ombuds has found nothing wrong with clinical care, found something with hospital services, is not the way to go. All aspects are important. Because, if the procedure is great and you get a post-op infection and you're killed by the infection, the outcome was not favorable for you as the patient. When you look at the numbers of patients, we went to an oversight in the Northwest and found a clinic in Kgosi where the nurses were battling. The temperatures were high. The waiting room was full. And 2 nurses were seeing over 200 patients in a day. Then you go to the pharmacy. The pharmacy is inadequately stocked. Patients have to come back. Medicines are not there. So the challenges are vast, and we cannot pick and choose and say this is not important. Now, part of the issue is that you go to other facilities that are better equipped, better resourced with human resources, where traffic of patients is managed, and you see underutilized facilities. What you need is a national plan. What you need is to make health a national competence, so that at national, you are able to ensure that you have the resources where they are needed. That the hospitals that they have the highest traffic are the ones that are most resourced. And the ones that have less traffic are appropriately resourced. So we have a systemic problem. We also, in your opening remarks, you were talking about the issue of the budget, and that there's utterances that we need money from taxes. There's no question about the fact that we have multiple factors that impact on the performance of the healthcare system. And you need a multi-pronged approach.
And it seems like I want to jump in there because I think it's encroaching on my next point, Prof. Sorry to jump in. This the response to some of the points that you're making, from government, it seems is the NHI. They're saying, well, the NHI is going to be the solution for all of these issues that you're facing. You've spoken about underutilized hospitals, and most of them are in the private sector. What impact do you think this kind of thinking, this kind of approach, and also some of these hiring decisions will have on the broader goal of implementing the NHI? And can the NHI survive without seriously addressing some of these issues if it does indeed get a place in South Africa?
I think the first thing to correct is to ensure that people understand that there are underutilized hospitals even in the public sector. We've just come back from KZN. And if you go to Prince Mshini Hospital, it's overflowing with patients. If you go to Pixley Hospital, you see fantastic facilities, and there wasn't an overabundance of patients. There was more facility than patients. So that imbalance exists. Some of those are regional hospitals. You go to Chief Albert Lutuli, which is a tertiary hospital. You don't have massive patient inflows, but that might be understandable. But when you have a regional hospital that's underutilized, and you have another hospital equivalent that is overutilized, oversubscribed, there needs to be a proper redistribution of those resources. Now, when it comes to the issue of national health insurance, the minister himself will always speak about the fact that there are multiple factors to a functional healthcare system. There's 6 or 7 of them. And they include human resources, leadership, facility, procurement, drugs, financing, amongst others. So unless you have a comprehensive plan that looks at both, you are not providing a solution. Because like we have said, there are instances where you need money. There are instances where you have wastefulness with money. There are instances where you have inappropriate use of money. The fact that you have a minister that can do his job, go and advocate to the Minister of Finance to make money available for employment of healthcare professionals, and still not be sure that that money will be used for the purpose that it is intended for the purpose that he went and canvassed for, means there is a structural problem that needs to be fixed. So remember, the other issue about human resources is when you look at our public services, it's dying from the weight of administration. There's too much money being spent on administration, which is also not that efficient. I mean, you go to the hospitals. When we went to Prince Mshini Hospital, record keeping is a disaster. Patient wait for files for 6-8 hours, waiting for the file. Don't talk about being seen. We spend so much money in the different provinces on health information systems, and we have nothing to show for it. There's a system that is being piloted by the minister, but the province doesn't have to take it. The province can refuse to use it. The province can start their own scheme. That's part of the problem. That's one of the major contributions to a dysfunctional public healthcare system. Just go into the private clinics. When you have a group, you don't have each hospital in that group doing its own thing. They'll be working from one template. They'll be singing from one hymn sheet. Now, you want to centralize funding. You want to nationalize funding, but you're not nationalizing the health system. Once you've nationalized it, once you've created this fund, how are you going to spend it? You still have to call the National Health Council. You still have to devolve money to the provinces to deliver services, because the fund will not be able to deliver services. There's also some glaring issues that have not been explained. The fund is a purchaser. Now, currently, the way we fund our public healthcare system, it's not funded on purchasing. It's funded on devolving funding to them from the budget. So you give them the money, and the other ones that are going to purchase, that are going to do X, Y, and Z. They are going to employ, freeze posts when people resign, etc., etc. Now, Once that aspect is not nationalized, what are you doing? When you have the money and you have to pay for services because you are a purchaser, what are you purchasing? Are you purchasing services from the provincial head and the premier of the province? What services are you paying for? Are you going to be billing for procedures? Are you going to be billing for, paying for prescriptions? There's no simple, clear mechanism of what transformation is occurring with creating a fund. There are also major problems with what is being proposed. I hope South Africans are engaging with the regulations published by the minister early March. 3 months to comment. There are serious concerns about what is being proposed in terms of regulating that fund. The first major concern is the fact that you have this fund, which will arguably be the biggest fund in this country. And Parliament has no oversight in terms of appointment of the people that are going to run this fund. I mean, I am an alternate member on a committee of portfolio committee for women, youth, and people with disability. We have the NYDA and the appointments of the board of the NYDA. The process is done by the committee, open, transparently, with the public participating in those interviews, with those applying criteria being out there, public commenting. We have those aspects in what is being suggested by the minister. But Parliament is totally sidelined. The Parliamentary Committee of Health has got absolutely no say, no involvement in any aspect of the regulations of regulating this NHI. So Parliament is totally bypassed, and the authority rests with the minister, being the one that sets up the selection committee, being the one that approves the board, then makes recommendations to cabinet, then it gets signed off. Parliament is absent from that thing. So, we haven't even begun to have the serious debates that we have to have about NHI. NHI is a money bill. Treasury and the finance minister have been totally silent on these issues. Before the minister goes developing more things about NHI, we need to hear from finance in terms of how it is going to work. The minister will talk about the fact that there'll be a health tax, but that is vague, that is open. Nobody knows how this tax is going to work. Who's going to be collecting that tax? Will the minister be doling out contracts from that board about someone to go and collect the money? Treasury is silent. How is that going to work? Is that going to be another NSFAS mess? The payments to providers, the purchasing. Who's going to be paying? How? On what basis? On what criteria? If you engage the private sector for procedures, what procedural terminology is being discussed? Where and how? I mean, there are so many challenges with this thing that if you wanted universal healthcare, if you want national health, you fix public healthcare. And I would be totally supportive of the minister that says, let's fund public healthcare properly.
No, definitely, and I think we're going to leave on that note, Prof. Unfortunately, we have run out of time. We unfortunately have run out of time. Doc, thank you so much for chatting to us. I think it's always insightful, listening to, your comments, particularly when it comes to the implementation of the NHI, and if it will be the blanket answer to, our health, issues here in South Africa. But I think you make a very, very important point when it comes to, the NHI. You first need to fix the public health sector, which I think is in ruins right now. But because of time, Doc, I'm going to let you go. But I hope that we chat soon, just to unpack, I think, further. The NHI is so I think we can call it a mess at this point when it comes to its implementation and what it entails. And I think it's people like you that can help us understand, what is the end goal of government and how they plan on, implementing the NHI. But we're going to leave it here for now, Doc. Thank you so much. Really, really appreciate it.
Thank you very much. And I'll be happy to come back so that we can unpack the monster called NHI.
Definitely. Dr. Kgosi Letlape, Action SA MP. He's a healthcare activist, and he's also a member of the Parliament Portfolio Committee on Health. So I think his insights are very, very, very important. They're very, very valuable as someone that's very, very close to, I think, an issue that's affecting all of us in South Africa, the issue of healthcare. South Africa's health system, I think, has been on a downward trajectory for a very, very long time. It almost feels like those that are in power don't seem to understand, can't grasp, how to fix it. NHI now in the mix, a monster, as Dr. Kgosi Letlape explains it, that, it'll take, I don't know how long for all of us to understand, the NHI, what it means, how does it work, how does it affect you and I, citizens of this country, whether you use public health or you use private health. Ultimately, it's going to touch you. And the issues of taxes also. How is this thing going to be funded? I think that's the big question. We're going to take a quick break. When we come back, News and Views continues.